Monkeypox is a rare disease that is caused by infection with monkeypox virus. Monkeypox virus belongs to the orthopox virus genus in the family Poxviridae. The orthopox virus genus also includes variola virus, which causes smallpox, vaccinia virus used in the smallpox vaccine, and cowpox virus. A small story about the monkeypox virus. The monkeypox virus was first discovered in the year 1958 when two outbreaks of a pox-like disease occurred in colonies of monkeys kept for research, hence the name monkeypox. The first human case of monkeypox was recorded in the year 1970 in the Democratic Republic of the Congo during a period of intensified effort to eliminate the smallpox. Since then, monkeypox has been reported in people in several other Central and Western African countries like Cameroon, Central African Republic, Cote d'Ivoire, Democratic Republic of the Congo, Gabon, Liberia, Nigeria, Republic of the Congo, and Sierra Leone. The majority of infections are in the Democratic Republic of the Congo. Monkeypox cases in people have occurred outside Africa linked to international travel or imported animals, including cases in the United States as well as Israel, Singapore, and the United Kingdom. The natural reservoir for monkeypox remains unknown. However, African rodents and non-human primates like monkeys may harbor the virus and infect people. In humans, the symptoms of monkeypox are similar to but milder than the symptoms of smallpox. The main difference between the symptoms of smallpox and monkeypox is that monkeypox causes lymph nodes to swell, that is lymphadenopathy, while smallpox does not. The incubation period for monkeypox is usually 7 to 14 days but can range from 5 to 21 days. A person affected with monkeypox experiences these signs and symptoms. The illness usually begins with fever, headache, muscle aches, back pain, swollen lymph nodes, chills, exhaustion. Within 1 to 3 days, sometimes longer, after the appearance of the fever, the patient develops a rash, often beginning on the face, then spreading to other parts of the body. Monkeypox lesions progresses from macules to papules, from papules to vesicles, and then to pustules, and then it ends with scabs. The illness typically lasts for 2 to 4 weeks. In Africa, the monkeypox has been shown to cause death in as many as 1 in 10 persons who contract the disease. The transmission of monkeypox virus occurs when a person comes in contact with a virus from an animal, human, or materials contaminated with a virus. The virus enters the body through broken skin even if it is not visible, respiratory tract, or the mucous membrane through eyes, nose, or mouth. The transmission of this monkeypox virus takes place animal to animal transmission, human to human transmission, or indirect transmissions. Animal to human transmissions may occur by bite or scratch, bushmeat preparation, direct contact with body fluids or lesion materials, or indirect contact with lesion materials such as through contaminated bedding. Human to human transmission primarily occurs through large respiratory droplets. Respiratory droplets generally cannot travel more than a few feet, so prolonged face-to-face contact is required. In the case of indirect transmissions, other human-to-human methods of transmission include direct contact with body fluids or lesion materials, and indirect contact with lesion materials such as through the contaminated clothing or the linens. Transmission of monkeypox virus can be prevented by avoiding the contact with animals that could harbor the virus, including the animals that are sick or that have been found dead in areas where monkeypox virus occurs. Avoiding the contact with any material such as bedding that has been in contact with a sick animal. Isolating the infectious patients from others who could be at risk for infection. Practice good hand hygiene after contact with infected animals or humans. For example, washing your hands with soap and water or using an alcohol-based hand sanitizer. Use personal protective equipment (PPE) when caring for patients. These are the preventive measures in the case of monkeypox. Is there a vaccination against the monkeypox virus? Yes, Jynneos, also known as the Imvamune or Imvanex, is an attenuated live virus vaccine which has been approved by the US Food and Drug Administration for the prevention of monkeypox. The Advisory Committee on Immunization Practices ACIP is currently evaluating JYNNEOS for the protection of people at risk for occupational exposure to orthopox viruses such as smallpox and monkeypox in a pre-event setting. Apart from this, a still newer vaccine based on a modified attenuated vaccinia virus Ankara strain was approved for the prevention of monkeypox in the year 2019. This is a two-dose vaccine for which availability remains limited. Smallpox and monkeypox vaccines are developed in formulations based on the vaccinia virus due to cross protection afforded for the immune response to orthopox viruses. Therapeutic management. The clinical care for monkeypox should be fully optimized to alleviate the symptoms, manage complications, and prevent long term sequelae. Patients should be offered fluids and food to maintain adequate nutritional status. Secondary bacterial infections should be treated as indicated. An antiviral agent known as tecovirimat that was developed for smallpox was licensed by the European Medical Association EMA for monkeypox in the year 2022 based on data in animal and human studies. It is not yet widely available. If used for patient care, tecovirimat should ideally be monitored in a clinical research context with prospective data collection. Thank you.